Activation of the sympathetic nervous system is one of the primary mechanisms through which cold exposure exerts its health benefits. When the body is exposed to cold environments, whether through ice baths, cold showers, or outdoor winter immersion, it experiences a rapid physiological response designed to preserve core temperature and maintain homeostasis. Central to this response is the activation of the sympathetic branch of the autonomic nervous system, which orchestrates a series of changes including the release of norepinephrine, increased heart rate, and heightened alertness. Norepinephrine, a neurotransmitter and hormone, plays multiple roles in both the peripheral and central nervous systems. In the periphery, it acts as a vasoconstrictor, narrowing blood vessels to reduce heat loss and maintain core body temperature. Within the brain, norepinephrine enhances alertness, attention, and focus, which contributes to the characteristic mental sharpness often reported during or immediately after cold exposure. Elevated norepinephrine levels also exert anti-inflammatory effects by modulating immune cell activity and cytokine release, which can help reduce chronic inflammation and improve recovery from physical stressors. This combination of neurological and immunological effects positions cold exposure as a tool not only for immediate physiological adaptation, but also for long-term resilience. Another critical aspect of sympathetic activation during cold exposure is its impact on cardiovascular function. Cold-induced vasoconstriction increases peripheral resistance, temporarily raising blood pressure and stimulating the heart to work harder. While this may seem stressful in the short term, repeated exposure trains the cardiovascular system to handle acute stressors more efficiently. Over time, this can improve vascular tone, enhance circulation during non-stress periods, and support overall heart health. This cardiovascular training effect mirrors some of the benefits of aerobic exercise in that it strengthens the body's adaptive capacity to manage environmental challenges. The sympathetic activation also influences metabolism. Norepinephrine stimulates thermogenesis in brown adipose tissue, increasing energy expenditure to generate heat. This metabolic boost supports not only energy balance and weight management, but also glucose regulation and insulin sensitivity. In essence, sympathetic activation serves as a trigger for multiple downstream pathways that collectively improve both systemic and cellular function. Psychologically, the activation of the sympathetic nervous system during controlled cold exposure can enhance stress resilience. By repeatedly subjecting the body to a manageable stressor, individuals learn to tolerate discomfort, regulate breathing, and maintain focus under pressure. This can translate to improved coping mechanisms in everyday life, reducing the impact of acute stressors on mood and cognitive performance. The neurochemical changes, particularly elevated norepinephrine, also enhance mood and provide a sense of clarity and alertness, which can contribute to mental health benefits. Importantly, the magnitude of sympathetic activation depends on several factors, including water temperature, exposure duration, and individual conditioning. Short exposures to moderately cold water can effectively stimulate norepinephrine release without excessive cardiovascular strain, while prolonged exposure to extreme cold requires careful monitoring and gradual adaptation. Additionally, regularity and consistency play a critical role. Repeated, controlled exposures allow the sympathetic system to adapt, enhancing both physiological and psychological resilience. The activation of the sympathetic nervous system through cold exposure is a multifaceted mechanism that integrates cardiovascular, metabolic, immune, and neurochemical responses. By leveraging this response, individuals can enhance alertness, mood, stress tolerance, and overall systemic resilience, creating a foundation for broader health benefits that extend beyond the immediate experience of cold. Improved circulation and cardiovascular function are among the most significant benefits derived from both cold and heat exposure. The body's cardiovascular system is highly responsive to thermal stress, adapting dynamically to maintain core temperature, regulate blood flow, and ensure adequate oxygen delivery to tissues. Understanding these adaptations is essential for leveraging thermal exposure as a tool for overall health. Cold exposure induces a process known as vasoconstriction, where blood vessels in the periphery narrow to conserve heat and maintain core body temperature. This constriction increases peripheral resistance, temporarily elevating blood pressure and stimulating the heart to pump more efficiently. Upon rewarming, whether through returning to a warmer environment or transitioning to heat exposure, the blood vessels undergo vasodilation, expanding to increase blood flow and facilitate nutrient and oxygen delivery. This repeated cycle of constriction and dilation acts as a form of vascular exercise, training the blood vessels to respond more efficiently to changes in demand. Over time, this can improve vascular flexibility, which is crucial for maintaining healthy blood pressure and reducing the risk of cardiovascular disease. Heat exposure, such as through saunas or hot baths, complements the cardiovascular benefits of cold by inducing sustained vasodilation. The increase in blood flow elevates heart rate and cardiac output, mimicking moderate-intensity aerobic exercise without the mechanical load on muscles and joints. Regular heat exposure has been associated with improved endothelial function, which refers to the ability of blood vessels to dilate properly in response to stimuli. Enhanced endothelial function supports better regulation of blood pressure, reduces arterial stiffness, and decreases the risk of cardiovascular events such as heart attack or stroke. Both forms of thermal stress, cold and heat, also influence heart rate variability, HRV, a measure of autonomic nervous system balance and cardiovascular resilience. Short-term exposure to cold increases sympathetic activity, elevating heart rate and norepinephrine levels, while subsequent rewarming encourages parasympathetic rebound, promoting relaxation and recovery. Heat exposure predominantly engages the parasympathetic system during the recovery phase, enhancing HRV and supporting cardiovascular adaptability. Over time, these repeated cycles of thermal stress help condition the autonomic nervous system, improving the body's ability to respond to physical and psychological stressors. At a microvascular level, thermal exposure promotes capillary recruitment and improved tissue perfusion. Increased blood flow during heat exposure enhances oxygen and nutrient delivery to muscles, skin, and vital organs, supporting cellular metabolism and tissue repair. Similarly, cold-induced vasoconstriction followed by vasodilation stimulates microvascular function, which may aid in recovery from exercise or injury by improving the efficiency of nutrient and waste exchange at the cellular level. Additionally, both cold and heat exposure can support metabolic and hormonal pathways that interact with cardiovascular function. Cold exposure stimulates norepinephrine release, which not only promotes alertness and fat metabolism, but also transiently enhances cardiac contractility and vascular tone. Heat exposure induces mild hyperthermia, which elevates heart rate, cardiac output, and circulatory efficiency, while also promoting the release of heat shock proteins that support vascular health. Integrating these practices consistently allows the cardiovascular system to become more adaptable and resilient. Whether through short bouts of cold immersion, regular sauna sessions, or alternating between the two, repeated thermal stress conditions the heart, blood vessels, and microcirculation to respond more effectively to both environmental and internal demands. Over time, these adaptations translate to improved blood pressure regulation, enhanced vascular flexibility, and a reduced risk of chronic cardiovascular conditions. Metabolic activation and stimulation of brown adipose tissue are critical mechanisms through which cold exposure can enhance overall health and energy regulation. Brown adipose tissue, or brown fat, is a specialized type of fat tissue that generates heat by burning calories, a process known as non-shivering thermogenesis. Unlike white fat, which primarily stores energy, brown fat is metabolically active and contributes to thermoregulation, energy expenditure, and glucose homeostasis. Cold exposure triggers this system, activating pathways that increase calorie burning and improve metabolic efficiency. When the body is exposed to cold, thermoreceptors in the skin and peripheral tissues send signals to the hypothalamus, the brain's thermoregulatory center. This activates the sympathetic nervous system, which in turn releases norepinephrine. Norepinephrine binds to beta-adrenergic receptors in brown fat, stimulating the mitochondria to produce heat by burning stored lipids and glucose. This not only helps maintain core body temperature, but also increases overall energy expenditure. Repeated exposure to cold over time enhances brown fat activity, which can improve basal metabolic rate and support weight management. In addition to burning calories, brown fat activation improves glucose metabolism and insulin sensitivity. By using glucose as a fuel source for heat production, brown fat helps regulate blood sugar levels, reducing spikes after meals and improving overall metabolic control. This is particularly relevant for individuals at risk of type 2 diabetes or metabolic syndrome. Studies have shown that regular cold exposure can increase insulin sensitivity, helping the body maintain stable blood glucose levels and reducing the long-term risk of metabolic disorders. Cold-induced metabolic activation also influences lipid metabolism. When brown fat is activated, it oxidizes fatty acids to generate heat, which can reduce circulating triglycerides and improve lipid profiles. Over time, this contributes to better cardiovascular health and energy balance. Furthermore, the combination of increased glucose and fatty acid utilization enhances overall mitochondrial function, supporting cellular energy efficiency and reducing oxidative stress. Beyond brown fat, cold exposure also stimulates other metabolic pathways. For example, it can promote mitochondrial biogenesis, the creation of new mitochondria, which increases the capacity for energy production and improves endurance. The release of norepinephrine and other catecholamines during cold stress further supports lipolysis, mobilizing stored fat for energy and reinforcing metabolic flexibility. This flexibility allows the body to efficiently switch between carbohydrate and fat utilization depending on energy demands and environmental conditions. Psychologically, cold exposure can also influence metabolism indirectly. The acute stress of cold immersion triggers alertness and mental focus, which can support adherence to healthy behaviors such as exercise and dietary regulation. The combination of neurochemical activation and metabolic engagement creates a feedback loop that reinforces overall energy management and resilience. Regular and controlled cold exposure, even for brief durations, can lead to measurable improvements in energy expenditure, fat oxidation, glucose regulation, and overall metabolic health. Over time, these adaptations support weight management, reduce risk factors for metabolic disease, and enhance cellular energy efficiency, demonstrating that cold is not just a stressor but a potent metabolic tool when applied safely and consistently. Heat exposure promotes health through the induction of heat shock proteins and the enhancement of cellular repair mechanisms. When the body is subjected to elevated temperatures, whether through sauna sessions, hot baths, or infrared therapies, it experiences a controlled physiological stress that triggers adaptive responses at both the cellular and systemic levels. Heat shock proteins, HSPs, are a central component of this response. These proteins act as molecular chaperones, assisting in the proper folding of newly synthesized proteins, repairing damaged proteins, and preventing the accumulation of misfolded or aggregated proteins that can contribute to cellular dysfunction. Activation of heat shock proteins is particularly important for cellular resilience. During heat exposure, cells experience mild protein stress, which signals the need for protective mechanisms. HSPs respond by stabilizing and refolding proteins, enhancing the cell's ability to cope with stress, and improving overall protein quality control. This not only helps maintain cellular function during acute stress, but also reduces long-term damage associated with oxidative stress and aging. In this way, regular heat exposure can support longevity and reduce the risk of age-related cellular decline. Heat also has profound cardiovascular effects that complement its cellular benefits. Elevated temperatures cause vasodilation, which increases blood flow and enhances oxygen and nutrient delivery to tissues. The heart rate rises, cardiac output increases, and the cardiovascular system experiences a mild but significant form of exercise. This repeated cardiovascular challenge improves vascular function, reduces arterial stiffness, and supports overall heart health. Regular heat exposure has been linked to lower blood pressure, improved endothelial function, and reduced risk of cardiovascular events. The combination of improved circulation and enhanced cellular resilience creates a powerful synergy for systemic health. Metabolic benefits are another important outcome of heat exposure. By elevating core temperature, heat stress stimulates metabolic activity, increases energy expenditure, and promotes mitochondrial efficiency. Mitochondria, the energy powerhouses of the cell, are better able to produce ATP, the energy currency of cells, and repair mechanisms are more active, supporting overall energy metabolism. The activation of heat shock proteins also reduces oxidative stress and inflammation, both of which are critical for maintaining metabolic health and preventing chronic disease. Heat exposure also affects the brain and nervous system. It increases the release of neurotrophic factors, such as brain-derived neurotrophic factor, BDNF, which supports neuronal growth, plasticity, and cognitive function. This makes regular heat exposure beneficial not only for physical health, but also for mood regulation, stress resilience, and overall cognitive performance. The combination of improved circulation, cellular repair, and neurotrophic support demonstrates that heat exposure is a multi-system intervention with wide-ranging benefits. Furthermore, heat exposure supports recovery and performance enhancement. Increased blood flow helps deliver nutrients to muscles and remove metabolic waste products, aiding in post-exercise recovery. The cardiovascular and metabolic demands of heat also act as a form of conditioning, improving overall endurance and resilience to physical stress. Psychologically, controlled heat exposure can improve tolerance to discomfort and stress, enhancing mental fortitude and promoting a sense of well-being. By incorporating heat exposure consistently and safely, individuals can harness the benefits of heat shock proteins, improve circulation, metabolic enhancement, and neural support. These adaptations collectively strengthen the body's ability to withstand stress, recover from physical and mental challenges, and maintain long-term health. Recovery and performance enhancement through contrast therapy, the alternating use of cold and heat, leverages the unique physiological benefits of both thermal extremes. By strategically cycling between cold exposure, such as ice baths or cold showers, and heat exposure, such as saunas or hot baths, the body experiences rapid shifts in temperature that stimulate cardiovascular, neural, and metabolic adaptations. These fluctuations act as controlled stressors, improving resilience and accelerating recovery processes that are critical for both physical performance and long-term health. One of the primary mechanisms through which contrast therapy enhances recovery is vascular conditioning. Cold exposure causes vasoconstriction, reducing blood flow to peripheral tissues to conserve heat, while subsequent heat exposure induces vasodilation, increasing blood flow and nutrient delivery. This repeated constriction and dilation acts like a pump for the circulatory system, helping to flush metabolic waste products from muscles, reduce inflammation, and improve the delivery of oxygen and nutrients necessary for tissue repair. Over time, this improves vascular flexibility, strengthens the cardiovascular system, and supports better blood pressure regulation. Contrast therapy also influences the autonomic nervous system by alternating sympathetic and parasympathetic activation. Cold exposure predominantly engages the sympathetic nervous system, releasing norepinephrine and increasing alertness and stress resilience. Heat exposure, in contrast, promotes parasympathetic rebound, helping the body relax and recover. The repeated cycling between these states trains the autonomic nervous system to respond more efficiently to environmental and internal stressors, improving overall stress management, sleep quality, and recovery capacity. Metabolically, contrast therapy enhances mitochondrial efficiency and energy utilization. Cold exposure stimulates brown adipose tissue and thermogenesis, increasing calorie expenditure and improving glucose and lipid metabolism. Heat exposure simultaneously increases heart rate and blood flow, stimulating mitochondrial activity and energy production. The combination of these effects creates a robust metabolic response, supporting both performance optimization and long-term metabolic health. Athletes and fitness enthusiasts may find that regular contrast therapy accelerates recovery from intense training sessions, reduces delayed onset muscle soreness, and maintains endurance and strength over time. Neurologically, alternating temperatures can stimulate the release of neurotrophic factors such as brain-derived neurotrophic factor, BDNF, which supports neuronal growth, plasticity, and cognitive resilience. Exposure to these controlled stressors enhances mental clarity, focus, and mood, creating a synergistic effect where physical and mental performance improvements reinforce each other. By challenging the nervous system in a safe and controlled manner, contrast therapy trains both body and brain to respond adaptively to stress. Psychologically, contrast therapy also builds tolerance to discomfort and strengthens mental fortitude. Enduring the sudden transition from cold to heat requires controlled breathing, focus, and emotional regulation, which are transferable skills that improve resilience in daily life. The sense of accomplishment and the acute physiological wake-up from cold exposure, followed by the relaxation of heat, can improve mood, motivation, and adherence to health and fitness routines. The timing, duration, and sequencing of cold and heat are critical to maximizing benefits while minimizing risk. Short periods of cold exposure, ranging from 1 to 5 minutes, followed by longer periods of heat exposure, around 15 to 30 minutes, are generally effective for stimulating recovery and performance adaptations. Repeated sessions, 2 to 4 times per week, allow the body to adapt progressively and safely. Individual tolerance, cardiovascular health, and environmental conditions must guide these practices to ensure safety and effectiveness. Contrast therapy combines the physiological and neurological benefits of cold and heat, creating a powerful tool for accelerating recovery, enhancing performance, and promoting overall health. By strategically alternating temperatures, individuals can optimize vascular function, autonomic flexibility, metabolic efficiency, and cognitive resilience, resulting in a comprehensive neurotrophic and cognitive benefits are significant outcomes of both cold and heat exposure, reflecting how controlled thermal stress influences brain function and mental performance. These benefits are largely mediated through the upregulation of neurotrophic factors, particularly brain-derived neurotrophic factor, BDNF, which plays a central role in supporting neuronal growth, synaptic plasticity, and cognitive resilience. Thermal stress, whether from cold immersion or heat exposure, activates adaptive physiological pathways that enhance brain health, mood regulation, and mental clarity. Cold exposure stimulates the sympathetic nervous system and elevates norepinephrine levels, which not only improves alertness and attention, but also has downstream effects on neuroplasticity. Norepinephrine interacts with neural circuits involved in learning and memory, enhancing signal-to-noise ratios in cortical networks. This heightened neural efficiency can make the brain more receptive to forming new connections and integrating information. In parallel, cold-induced thermogenesis activates metabolic pathways that improve mitochondrial function, ensuring that neurons have adequate energy to support cognitive processes. These combined effects can enhance focus, reaction time, and executive function, particularly in situations that require sustained attention or rapid problem solving. Heat exposure, through saunas or hot baths, induces a different but complementary set of neurocognitive benefits. Elevated body temperature triggers the production of heat shock proteins, which not only protect cellular proteins, but also support overall neuronal health. Heat exposure also increases blood flow to the brain, improving oxygen and nutrient delivery, which supports synaptic function and energy metabolism. Additionally, heat-induced mild hyperthermia stimulates the release of BDNF and other neurotrophic factors, promoting synaptic plasticity and strengthening neural networks. Over time, repeated heat exposure can improve memory consolidation, learning capacity, and adaptability to cognitive challenges. Alternating between cold and heat, often referred to as contrast therapy, combines these neurotrophic benefits, creating a powerful stimulus for brain plasticity. The shifts in temperature challenge the autonomic nervous system, enhancing stress resilience while simultaneously promoting cognitive flexibility. The sudden transitions between cold-induced sympathetic activation and heat-induced parasympathetic engagement provide a dynamic environment for the brain, training it to adapt efficiently to changing conditions. This improves not only mental resilience but also emotional regulation, as the brain becomes better at managing both external and internal stressors. From a psychological perspective, the acute effects of thermal exposure can improve mood and motivation. Cold exposure often induces a sense of alertness and clarity, while heat exposure promotes relaxation and a feeling of well-being. These neurochemical shifts, including elevated dopamine and norepinephrine during cold exposure and parasympathetic engagement during heat, enhance emotional balance and reinforce learning and focus. The combination of improved cognition, mood, and resilience creates a synergistic effect that can benefit daily performance, productivity, and mental health. Long-term neurocognitive adaptations also occur through repeated, consistent exposure. Regular thermal stress enhances the brain's capacity for plasticity, supporting the formation of new neural connections and the strengthening of existing ones. This is particularly important for maintaining cognitive function with aging, reducing the risk of neurodegenerative disease, and improving the brain's ability to recover from stress, injury, or metabolic challenges. Integrating controlled cold and heat exposure into a routine provides a natural, non-pharmacological method to enhance brain function. By stimulating neurotrophic factors, supporting synaptic plasticity, and improving cerebral circulation, these practices promote sustained cognitive performance, emotional stability, and adaptive resilience. The neurotrophic and cognitive effects of thermal exposure highlight that these interventions are not just physical stressors. They are powerful tools for optimizing brain health and mental clarity over time. When practiced consistently and safely, cold and heat exposure offer more than physical benefits. They create a supportive environment for the brain to grow, adapt, and function at its best. By stimulating neurotrophic factors, enhancing circulation, and promoting plasticity, these practices improve cognition, focus, and emotional regulation. Over time, they strengthen both mental and physiological resilience, making the brain more adaptable to stress, more efficient in learning and problem solving, and better equipped to maintain long-term health and well-being.